right. Hi, everyone. Welcome. Thank you all so much for being here. We appreciate you. Welcome to Eating, Emotions, and Health, co-hosted by NAMI-NYC and the Renfrew Center. My name is Clara, and I'm going to be moderating this afternoon. And I'm going to start with some logistical considerations. You will note that this meeting is being recorded. We will also be starting a live stream to Facebook in just a minute or two. But we're going to give folks another minute to kind of join in. We have, as you may have noticed, ASL interpretation available. I'm going to put a note in the chat about that. Para hispanohablantes, por favor, hacen clic en el globo en la parte inferior de la pantalla y selecciona español para oír la interpretación en vivo a español. Y si necesitan ayuda, por favor, piden ayuda en el chat. Yo les puedo ayudar cuando termino la introducción. Y también es necesario tocar donde dice silenciar audio original para solo escuchar al intérprete. So we do have Spanish interpretation available, and I'm going to put a note about that in the chat as well. And we should be turning on automatic closed captioning very shortly. Actually, let me make sure that that is perfect. Okay, yes, that should be on. And there's a note about that in the chat as well. Okay, so our initial flood of people has slowed down. So we are going to start the Facebook Live. We're just going to wait a moment for that to kick in. Sometimes it takes a moment. Hopefully I will see it when folks come, when we start off. But in the meantime, I love that folks are saying where they are calling in from. It's really great to see so many people from so many different places joining us. We are so thrilled to be able to share this information with so many people. As a quick technical note, hello, all right, we are live. Thank you so much to everybody joining on Facebook and to everybody who has joined us in the Zoom room from many different states across the United States, from many different countries across the world. We're so happy to have you. This is Eating, Emotions, and Health, co-hosted by NAMI-NYC, the National Alliance on Mental Illness of New York City, and the Renfrew Center of New York. We're really excited to be partnering with the Renfrew Center for this event. I am going to very quickly put the information regarding interpretation into the chat one more time, just to make sure that that is accessible to everyone. And thank you again to everyone for joining us. Again, for those of you who may have just joined, or for those of you joining on Facebook, my name is Clara. I am going to be introducing this event. I'm going to say a few words about NAMI-NYC, and then I'm going to be turning it over to our speakers to introduce the Renfrew Center and to take us away. I will also be in the chat throughout the event collecting questions for the Q&A portion. So we will be saving the questions for particular portions, but do please feel free to put questions and commentary in the chat throughout, and we hope to have a really lively discussion and conversation there as well. Again, the co-host of this event is NAMI-NYC, the National Alliance on Mental Illness of New York City. Our mission is to provide support, education, and advocacy to individuals and families impacted by mental illness. And what that means is that we have free virtual classes and support groups, both virtual and in person now, for people who are living with mental health issues or who are supporting someone who is living with a mental health issue. All of our groups and classes are facilitated, well, our groups and classes for people dealing with mental health issues are facilitated by people living with mental health issues. Our groups and classes for family members are facilitated and taught by family members. So we strive to have all of our programs be peer-led. You can find out more about all of our services, including our the in-person groups and classes that we are beginning to hold at our office in Midtown Manhattan, by going to our website, which is naminyc.org, or by calling our helpline. And I'm going to put that number in the chat as well, but that number is 212-684-3264. I could definitely say more, but this has already been a long introduction, and I do want to leave as much time as possible for our speakers. I do just want to end my introduction by saying that we are going to be touching on some difficult topics. The speakers may emphasize this as well, but I do really want to emphasize that anyone should feel free to step away from the event if you're feeling overwhelmed. We'll still be here. The event will be recorded, and the recording will be shared with everyone who registered. So we encourage you to take care of yourself however you need. So with that, I am going to turn it over to Ruthie Flynn, who is going to say a few words about Renfrew. But first, I'm going to introduce our primary speakers for this afternoon, Sheba Anthony and Casey Wells. Sheba Anthony is a team leader and therapist at the Renfrew Center of New York, who also serves as research liaison on the board of the International Association of Eating Disorder Professionals New York chapter. She is proud to be a South Asian therapist, and she has a passion for delivering eating disorder care to BIPOC populations. Casey Walls, is a nationally board certified psychiatric mental health nurse practitioner, providing care to individuals across the lifespan. She has worked for the Renfrew Center since spring of 2019, providing care for patients with disordered eating in partial hospitalization and intensive outpatient programs in Pittsburgh, Pennsylvania, and White Plains, New York. So with that, I'm going to pass it over to Ruthie. Thank you all so much for being here.
Thank you so much. Thank you, NAMI, Metro NYC, and Clara, and the amazing team that helped put this together. I'm so thrilled to be collaborating with you folks. And yeah, I think that the incredible breadth of free knowledge and support that you guys provide is something that we wanted to be a part of as well. So very grateful. Yeah, so talking a little bit about eating and emotions today. So this presentation will go on until about 5:15, and if you have questions, go ahead and put them in the chat. So my name is Ruthie. I am the professional relations representative for the Renfrew Center of New York. So I basically do like the outgoing referrals, and I collaborate with other organizations and kind of talk through like our referral process and our programming. So I'll mention a couple things about the Renfrew Center for those of you that might not be familiar. And I've already seen a couple of great questions in the chat, like already getting the lingo of eating disorder treatment. So we are a higher level of care. We have a residential facility in Philadelphia, and then another in Coconut Creek, Florida. The center that all three of us work at, Sheba, Casey, and I, is the Renfrew Center of New York, and that services a PHP and an IOP. So those are basically, longer stays, 5 days a week, several hours a day, care for eating disorders primary. And the Renfrew Center has really set the precedent for eating disorder treatment and research. We are incredibly evidence-based, and we really, we pride ourselves on being the first eating disorder treatment center in the nation. So standardized treatment is really our MO. We're also in network with many insurances, as you can see, over 430 and several Medicaid plans throughout the nation. And yeah, we're just really thrilled to continue providing, free resources, providing webinars, presentations like this. All of our clinicians kind of take a part in that. We do this typically with providers and hospitals and awesome people like the folks at NAMI-NYC as well. So yeah, and we already introduced these wonderful people that lead the team over at the NYC site, Sheba and Casey, and I'll go ahead and hand it over to them for our goals for today.
Awesome. Thank you again, everyone, for joining, and Ruthie and Nami for bringing us all together in this space. I might lose my voice or clear my throat a couple times, so don't mind me if I mute and unmute at times. That's what I'm doing. But I'm happy to kind of start this conversation with you all, and hopefully lead into future conversations with those around you. So some goals from today as we kind of move through this time together are to really unpack the complexity of all of our unique relationships with food, right? Because we're people, we're in this world, we all have a relationship with food in our lives. Navigating in food and feelings, similarly, right? You don't have to have an eating disorder to really navigate our lives through food and feelings, but especially in terms of eating disorders or disordered eating, what can we understand about how food does fit into the conversation? And even more so, what about medications, right? Because as with medications, side effects come into mind, but also, right, we have responses to, right, how we might feel about those side effects as well. So when those side effects connect to food and feelings, let's offer up a space in this time together to explore that. In terms of establishing and modeling a healthy relationship with food. In this time, I hope that we can kind of explore what that might mean, right? Especially if we're talking about eating disorders or supporting a loved one through eating disorder recovery. What are some of the approaches that providers might be telling a loved one in treatment? And what are some of the approaches that you can maybe even better understand? And that's what we want to really offer in this space, is how can we support this healthy relationship with food, and what is that? What does that look like? So food, I mentioned this before, but food is part of all of our lives. We know that, right? Because food is connected to survival, but food is connected to so much more than survival. And I think that's what really needs to be explored in every space and person that we're with, right? Because sure, it can be connected to mental health. Maybe that's part of the reason that brought you to this space today, but it's really connected to our genetic history, our religion and faith, society, and different subcultures that we are part of, right? And that ethnic and maybe cultural background that we come from or connect to in our lives, and right, our personal preferences as well, right? So food is not just about survival, but it's really about all the other ways that how we live with food in our life, and how food can really be central in a lot of different ways in our life. So, in talking about food, we definitely can't not talk about the cultures around food, which include diet culture, right? So we got some definitions on the page here of what is a diet. And it's really any way of eating or moving for the purpose of weight loss over health. So in turn, what is diet culture? And it's really a set of beliefs that worships thinness and equates it with health and moral virtue. virtue, right? So that morality around food really throws another dynamic into our relationship with food. So when we really talk about food, we can't not talk about how food exists in the world around us, this morality that maybe is assigned by different people in our life, maybe different cultures that we're within, and maybe right different diet cultures, right? Like you can see some here images on the page here, right? There's definitely different diets. We hear the word diets all the time: low carb diet, paleo, keto, XYZ, right? And we can't move through the world not moving through this type of information. So it's really important to really understand how it influences us individually and just as a society as a whole. So diet culture broken down. I think this is something so important that we definitely unpack with individuals in treatment and their loved ones that support them in treatment, right? Of totally understanding that maybe we really have values and beliefs that connect to diet culture, right? We're not always turning towards diet or body image for vanity, right? But actually our values and beliefs are housed within what makes this way of living, right? This relationship with food turn towards diet culture, right? And so, right, there's a lot of different influences to name in that. So the two of which here are capitalism and really white Eurocentric beauty standards, right? So it's probably fair to say, especially if any of you are familiar with American culture, like capitalism is important here. So is consumerism, right? So there is an industry that does profit off of diet culture. It also might feel like a really quick or just right, simple one-way ticket out there to achieve an ideal of thinness. And even if you know that maybe some diets could fail, there might be a lot of different things that tie us back and back into a diet or different diets, right? So maybe there are new products, new coaches out there, new information to reconsider a diet again and again, right? So there's reasons that we turn to diets for answers, and there's reasons that we turn towards certain body image ideals, right? And some of that being like standards around beauty. Maybe they're traditional standards around beauty, maybe they're maybe the current trends right now. We can definitely say that beauty is subjective to what's going on culturally, historically, and socially. And you can certainly read more around this, but to really just capture in a quick moment here, the thin ideal really happens to be rooted in whitewashed Eurocentric concept of beauty and status. There's a lot to be read about how fear around fatness can actually contribute to an eating disorder and how that's actually influenced by different systems and history as well. Okay. So yeah, sorry, Ruthie, thank you for managing the slides. So I guess like this quick note on the bottom, right? Like what is really captured within the thin ideal, right? It's not just about thinness. It's really about what do we equate thinness to? So that could be even equated to health. Fatness being deemed as wrong, right? Like even thinking about fat phobia and having that true fear in it and that morality assigned to fatness. Maybe the different values and beliefs in terms of what's important about controlling eating. And also then, right, the judgments placed on food of goodness and badness. So diets work until they don't. I think we all know that to a certain degree, right? But it doesn't really change how we go and approach a diet, right? Because we're kind of searching for really resolutions to different things, whether that be emotionally, mentally, or right, even physical health, right? But there's research out there that supports that rapid weight loss can really slow your metabolism, impact a lot of different parts of how your body works. And it can increase a lot of different things, right? It can increase your risk of dehydration, how your heart is working, and it can even weaken your immune system, right? So it can be really hard, right, when maybe weight loss feels like part of a way of maintaining health or even improving health. You might even hear it from medical providers, but thinking about, right, like there are a lot of other research out there that supports that weight loss can have other impacts as well. So the pressures of diet culture, I think I spoke to this as well. I get ahead of myself because all these things are really kind of woven together, right? So there's so many messages out there. Be thin, your life will be better. Eat this, not that. Exercise this way, not that way, right? And so that that languaging can really pull us in of being like, how do I go about this better? How can I live a better life? And to entrap food and weight and body image around this really can create a lot of confusion, right? And also pull us into a certain answer, a way of fixing it. It can create a lot of feelings, kind of noted as a few on the screen here. But we really want to offer a time in this space today to really think about, well, what brought us to feeling this way? What brought us to wanting to change our relationship with food? What brought us to wanting to change our relationship with feeling? What brought us to wanting to change our relationship about feeling and food, right? Because there's certainly a lot of different ways, a lot of ways that people will tell you how to feel and eat. But we want to make sure that everyone feels like they're making an informed choice, and also that, right, you're able to be yourself in it and not kind of change because there's always going to be someone that tells you to change. So,
okay. Oh, sorry, Sheba.
Yeah. So just a quick capture, but Casey, you can add in too if you want. When we talk about eating disorders, what does that mean? There's certainly certain ways that we can go about eating that isn't qualified as an eating disorder. And that's a little bit of what we're going to quickly capture in this slide here. So what the slide really is a range of having wellness as like kind of maybe an optimal relationship with food, to the other end of the spectrum of an eating disorder where you're really getting treatment for your relationship with food, amongst other things. So wellness and how that might show up in terms of feeling and food in your life is maybe you don't label foods as good or bad. You eat intuitively, eating when hungry, stopping when full. And maybe you occasionally eat just purely for pleasure or emotional reasons, right? You're really flexible in terms of what's happening with food, and you're eating throughout the day. Now, preoccupation. It's a little bit of a step beyond or maybe below wellness, right? Maybe you're feeling some body dissatisfaction. Maybe you want to make a change in how your body looks. Maybe you're also having some more thoughts about food, eating, and body more frequently throughout the day. And maybe more of those emotions become to these thoughts. So maybe some shame, guilt, or bad feelings in general about eating certain foods. Now, preoccupation can kind of lead into distress, right? Another bump up here, and thinking about food much more, maybe eating and body image, right? Having a lot more of these thoughts, and it's starting to interfere with your daily life. Maybe you're starting to be a little bit more fixed in how you're eating, maybe again, taking on certain of those diet approaches. Maybe you're also using food and your relationship with food to suppress your emotions or avoid your emotions, right? Like maybe it's aiding you in that way. And maybe you're even turning to your relationship with food in that way to take you out of distress while also still feeling a little bit more distressed about how you're making this choice. And then also maybe what's showing up for you in your life is working really hard to change your body and compensating for your eating choices, right? So as you're seeing here, we're stepping further and further into how food and eating is not only just taking up time in your day for survival, but it's really taking up time and energy in how you function and choose to function and live your life, where really the relationship with food and eating is starting to become more dysfunctional in your life. And that's really leading to eating disorders. As you can imagine, right, there's a lot more criteria that goes into diagnosing eating disorders and what that looks like in each person's individual experience. But when your preoccupation, distress around food really kind of surmount to a point where it's leading to a lot of dysfunction and a lot of struggles in terms of food, eating, and body image, that's where we kind of use that eating diagnosis, amongst other probably diagnoses, to really recognize, okay, we need to really offer some more support and exploration of how you can navigate and start to move towards that more healthy relationship with food.
And I just want to add, Sheba, I really love this slide because it kind of shows disordered eating on like a continuum or a spectrum, where it's not just I have a good relationship with food versus I have a bad relationship with food, or I have an eating disorder versus I'm fine. It's more, you know, you may not fit perfectly in 1-4 of these columns, but it's very much on a spectrum. So, you know, and people can kind of go in and out of different areas of the spectrum, right? So somebody could be diagnosed with an eating disorder, go through treatment, be in a good place in recovery, And then it kind of slip back in, be a little bit preoccupied, then causing more distress. It can be, things can fluctuate, your relationship can change. But we really want people to be all the way over in the wellness category, eating when you're hungry, stopping when you're full, enjoying what you're eating, not worrying about, eating in different foods from all different food groups in moderation, really just having a good positive relationship with food in your body. Oh, and I am also doing this one, I'm sorry. So mental illness and food, not just eating disorders. So this slide says a study of more than 2,400 individuals hospitalized for an eating disorder found that 97% had one or more co-occurring conditions. So almost all of them had co-occurring mood disorders, typically major depression. More than half of them had anxiety, such as OCD, PTSD, and then about a quarter had an alcohol or substance use disorder. So when we're talking about our relationship with food and disordered eating and eating disorders, it's typically not just that. There's other things that go into this, which is more specifically the next slide that she was going to share with us, what emotional eating really is.
Yes. So emotional eating really connects to what you can kind of see in terms of the image in the middle part of the screen of suppressing, avoiding, and or controlling a negative feeling state. Emotions don't have to be labeled as negative. Maybe you might identify with it at this time, but that's what kind of I mean by a negative feeling state, a way of feeling that maybe you have a negative connotation towards how you're feeling. So at the end of the day, eating disorders are an issue of emotional regulation, which is why I think it's really important to talk about emotions and eating when talking about eating disorders. And even if you're looking at almost any different eating disorder behavior, we can often find connections of how these behaviors become a way to avoid, control, or suppress emotions that are hard to tolerate. And that's what we kind of mean by negative feeling state. It's hard to tolerate, right? Going back to the words of like distress or preoccupation, right? Like there's something there that makes it hard to sit with an emotion or emotions. So the maintaining factor for a lot of different things, right, such as mental health issues or, right, really just anything that we might struggle with is like we might really have that drive, even that protective factor of trying to avoid negative emotional experiences. What that might do, though, is really keep us out of all the emotional experiences in our life, right? Which we don't want to tend toward that. So what we want to understand is, sure, food can be a coping mechanism for individuals with all kinds of mental health struggles, not just eating disorders. And what's really important is food is not the only coping mechanism, right? What are other ways you can explore, live your life, and have food flexibility, don't have to struggle with body image or how you look or needing to control how you eat, and can also be able to be with your feelings in your life. So I guess in summary too, right? Emotional eating is understanding that eating is connection to emotions. And so understanding that these behaviors aren't so much things that also really fully need to be pathologized, right? But like we're trying to find a way to cope with our emotions. And that's what sometimes can be eating disorder behaviors, like labeled as eating disorder behaviors, but that's what we can really turn to in terms of food, is turning to cope with our emotions. So getting to know your feelings better, right? So I kind of mentioned like, okay, if we're going to want to be able to get better at feeling all the things, how do we get better at feeling all the things? And that might start with getting to know yourself a little bit more by getting to know your feelings. The biggest part about this is to try to withhold your own judgment about yourself, right? So you might have your own criticisms of like, oh, I hate when I feel this, or I hate when I feel this about feeling this. And that also similarly can show up in your relationship with food and food choice and eating. What's important in exploring your own feelings and in terms of also exploring your own relationship with food is being able to recognize that you're going to have feelings about your feelings and still take inventory of what that looks like, right? So for some of the examples that we see here and walking through them together, sometimes you might say, like, when I'm stressed and overwhelmed, I tend to lose my appetite. Yeah, sure. What I also tend to do is maybe graze and pick up food to distract myself, right? If those things maybe happen in conjunction, right? Like, it's not just one thing leading to another, but maybe this is what's really happening in as a couple of different things under really feeling situations when you feel stressed and overwhelmed. For someone who might have been recently diagnosed with ADHD, they might notice, I go about my day really actually completely forgetting to eat at meal times. I also don't really recognize hunger cues in my body. What could this say about their relationship with eating? What does this maybe also connect to for their ADHD? Another example here, I recently started EMDR therapy and I'm feeling emotionally exhausted lately. At the end of the day, I've been seeking comfort by baking my favorite cookies, turning on the TV, and eating a large amount of food quickly and kind of tuning out. What this might really make sense is this definitely connects back to emotional exhaustion and seeking comfort in food and wanting to disconnect after something that's so laborsome in terms of emotions. This is the last example here. I have bipolar disorder, and when I have a manic episode, I tend to lose interest in food. I eat at odd times, and also it reinforces a dysfunctional sleep cycle, right? So in all these different examples here, it really pairs with different struggles that someone might have in terms of food and eating, and it can really be explained by other struggles they're also having as well. So food can really, really connect to our emotions and how we go about our day in these quick snapshots here.
Okay, so I am going to take in the next couple of slides, but we're kind of turning into like medication and treatment. So I was looking in the chat and I wanted to just address a couple of things real quick. So back on the slide that had the eating disorders on it, OSFED, I saw this question a couple of times. OSFED is, and Clara answered it, but I wanted to just explain it a little bit more, is other specified feeding and eating disorders. So it's kind of like someone may not meet criteria, may not fit great in that criteria for anorexia, bulimia, or binge eating, and they may have kind of a cluster of symptoms or may meet some criteria, but not all of them. So it is still as severe, still as, needing treatment. It is not anything about severity. It's more so, maybe somebody restricts throughout the day, purges once a week and maybe binges a few times, or, it's kind of like a combination of symptoms. RFID is avoidant restrictive food intake disorder, and that doesn't totally fit with the other ones. It's more when someone is avoidant of food for reasons that aren't related to body image. So somebody may have choked on something when they were little, so now they're afraid of choking, so they only eat soft foods, or they're afraid of vomiting because they have a terrible fear of vomiting, so they only eat foods that make them feel a certain way. It limits somebody's food intake based on other issues, maybe texture issues or the way something smells, or things like that. But it can also severely cause malnutrition and issues like that. And there was one other question that I wanted to answer. What was it? I'm drawing a blank now, but I'm going to move on. I'm coming in here with treatment and medication. So introducing medication into your treatment plan with the support of a trusted psychiatric provider and your therapist can be a transformative step in one's mental health journey. So, however, some medications may affect appetite and attitudes toward food. When I'm prescribing medication, and not only because I'm prescribing medication to patients that have eating disorders, but even when I work with people that don't have eating disorders, weight gain is a concern. It's one of the questions that I get a lot. In terms of certain medications, We use antidepressants like SSRIs and SNRIs for major depressive disorder, anxiety, OCD. There are no medications specifically for eating disorders, but we do often use SSRIs and SNRIs for eating disorders because of the comorbid depression and anxiety. So we're hoping that by improving the depression and anxiety, that emotional piece of it will improve, thus improving the relationship with food, if that makes sense. We do also use antipsychotics. We use them for some of the psychotic disorders like schizophrenia and schizoaffective, but then the mood disorders like bipolar, treatment-resistant depression, but we also kind of use it off-label for a lot of things too. We use antipsychotics to kind of help with that rigid thinking that comes with eating disorders, of knowing that something that you're doing is not good for your body, but still wanting to do it to pursue, whatever reason that your eating disorder came about. So we can use those. And then the mood stabilizers, they're for the mood disorders, for bipolar 1 and 2, schizophrenia, those sorts of things. They can also sometimes cause weight gain. So I always disclose that a medication could potentially cause weight gain. Personally, I would prefer that somebody hear it from me than going home and Googling and feeling like I wasn't being honest with them. Because as nice as the internet is, it also is not helpful sometimes. I had a patient recently who I wanted to add, she had bipolar 2 disorder, was on Lamictal and doing pretty well on it. Lamictal is one of the mood stabilizers, but we are at the highest dose of Lamictal and she still was struggling. I wanted to add Abilify, and I told her that we were going to use a low dose, that, weight gain is a side effect potentially, but I'm hoping at this low dose that, we wouldn't see any of that. She went home and searched Abilify in TikTok and found TikToks of all of these people who had good experiences, bad experiences. This made me gain 20 pounds. This made me do this. It's deceiving because you don't know anything about that person's story. You don't know what they're taking it for, what their lifestyle is like, what their genetics are like. You don't know anything besides that, 90-second video that you watched. And this happens a lot. I have this discussion a lot. I think finding a provider that is going to look at you as a whole person, look at everything about your life, treat you holistically, in terms of, not just your eating disorder, or not just your disordered eating, or not just your depression, or not just your diabetes, or whatever you have going on. I want a provider for everybody that looks at the whole picture. And someone who's going to be honest with you, someone that you can see frequently as possible. I know, with the virtual world, I think that has opened a lot of doors for psychiatry. It's still not where it needs to be, but I'm hoping that, with the virtual appointments, we can see patients like more frequently, someone that's going to be honest with you. And, if weight gain is a concern, I think coming up front and saying, hey, I know my depression is not well controlled. I'm concerned about weight gain. Can we keep an eye on it? And, exploring why you're concerned about weight gain, I think is important. If it's a core belief of, fatness is bad versus I have a family history of diabetes and I'm trying to, keep an eye on that. I think it's important to know why we're worrying about things. So yeah, that's that slide. The next one is the vicious cycle. It's a vicious cycle of, knowing that you need or would benefit from medication, but maybe potentially gaining some weight on it or not liking other side effects, then stopping it maybe on your own, and then symptoms coming back. Of course, there's always patients ask me all the time, do I have to be on this for the rest of my life? And I think that that's a question that I don't have the answer to. I say, I hope some people do, some people don't. Some people think, why I fix something that isn't broken and this is helping me and I'd like to stay on it, and that's great. Some people don't want to stay on meds for a long time, and I think that's okay too. And if you can get stable in terms of your mood and learn some coping skills to manage the other things that are that you're struggling with, and then eventually try to come off, I think that's great too. But discontinuing medication on your own because of side effects is something that I see a lot, that it doesn't always end very well. There's all sorts of reasons why people discontinue medication. I think when they discontinue medication because of a side effect that could have been discussed and brought up to the provider, then I think that is something that should be brought up. I had a patient the other day who she was in our PHP program for 8 weeks. I started her on a new antipsychotic for treatment-resistant depression. I started her on Rexulti, and she discharged, went back to her outpatient provider and emailed me and said, hey, Casey, I saw her today. She wants to not increase my medication. Why do you think that she doesn't want to? And I emailed her back and said, I don't know, ask her. You have asking and talking and being open with your providers, I think, is the best thing that you possibly can do. So meds, appetite, and weight, fact and fiction. So if weight gain is listed as a possible symptom, I will gain weight. Not correct. Medications impact everybody differently. So, sometimes people will gain a little bit, sometimes people won't gain anything. My question to some of my patients is, is 5 pounds more important than, decreased suicidal thoughts and able to get out of bed and enjoying your family and spending time with your kids? And, and if it is, then, maybe we have more things to talk about, but I'm hoping that mood stability is more important than, a couple pounds. Fiction. If I gain weight on my meds, it means I'm not healthy and I need to go off of them, even if my mental health is improving. So, when in reality, weight gain is not necessarily unhealthy, depending on the situation. Again, we need to look at people as a whole, and say, is there another reason for the weight gain? We need to look at medical, mental, emotional, physical health is mental health. So yeah, and I'm seeing the comments about my internet. I think this is my last slide for a minute. So I'm going to troubleshoot.
Thanks, Casey. It actually leads a little bit more into what I want to talk about is what Casey was bringing in of what is health? And we really want to look at the person as a full person, right? And so we totally understand when we're talking about food, eating, and body image that weight is something that is offered in a lot of provider appointments, in terms of what it means to be a certain weight and even recommendations around weight, food, and eating. But what we really want to encourage is conversations about what health is and really looking at that comprehensive overall look at a person's health, which isn't just about weight. And acknowledging the weight stigma that exists in the world is just part of the conversation. So what are other markers of health, right, that have nothing to do with weight? Sure, again, like I said before, weight can be part of the conversation in certain medical places and a lot of different parts of your life, as long as you also consent to. It might not be something at a certain moment in time that you maybe have something that you want to keep as part of the open conversation as well. But what are other markers of health? Maybe the quality of your closest relationships, people in your life, how close you feel in terms of your connections with them. Are you doing the things you enjoy with the people you enjoy doing them with? How are you feeling in terms of awareness and mindfulness? How present are you feeling in your life? And your values. How do you feel about like pursuing your values, what you're doing to help move towards them or away from them, right? When you feel like something is not in line with your values, right? And so health is also these things of really moving through your life, being able to live your life, and not just what weight might mean, how weight might be defined in your life, and also, right, how others might try to make weight define part of your life. And I think what's also important is like there's a lot of other markers of health out there. Your doctors, your providers might offer a recommendation around weight, and I encourage you all to, like Casey said, have conversations. Broaden the conversation of, okay, you mentioned something about my weight. What else can you kind of give me in terms of your medical recommendations? What are other things that can also show that I'm okay, right? Your blood work can show that you're okay, right? Just like the image on the last screen is, it's not just about what you look like and what you appear as. So emotional health. How can we make friends with our emotions? How can we live our life in a healthy relationship with our emotions? And that's what I kind of want to quickly touch upon in terms of some of the things that we talk about in terms of emotions here at treatment at Renfrew, right? I'm going to quickly breeze through this. So this is a quick snapshot, but I think this speaks back to some of the things I said. It's really important for us to be able to feel, because life is full of feelings, and we should have the full range of feelings to go through about our life, right? If we receive certain news, there's a lot of things happening in the world right now. We want to be in touch with our feelings and respond to our feelings. So what might we notice when we tune into our feelings? Our thoughts, our physical sensations, and our behaviors and urges. And these are what we kind of encapture in terms of our 3 components of an emotion here and how we talk about it at Renfrew. So once we notice these things and learn about our emotions, we can kind of move into step 2. Cueing step 2 of destigmatizing emotions here, right? Emotions all have a function. Emotions are meant to be responsive, which means that they can really have the potential to be adaptive and good and aid in our lives. Even bad emotions, right? Those emotions that we don't want to sit with aren't always bad. Emotions are really our body's way of saying, hey, something's going on here. So emotions can really alert us and help us respond. Negative reactions to emotions and avoidance of emotions maintain your symptoms. Another really important thing to recognize about emotions here, right? Our symptoms are really a way of how we're trying to avoid our emotions and get through certain things that are really hard in our lives. But what this can be is some short-term solutions to a problem that still exists. And it maybe even produces even more problems in the long term. Some things we kind of refer to, avoiding emotions as a really short-term solution in this way. And so that's why we really talk about coping skills and looking globally at what else we need to overcome struggles, whether that be treatment, whether that be different ways of getting support in our life, to really be able to cope with our emotions as a whole, and be able to have the full range of emotional experiences that life has to offer. So how this connects to our conversations here at Renfrew about food is really, again, what does this mean for you in developing a healthy relationship with food? At Renfrew here, we really think it's important and that all foods fit, meaning you can have all food in your life. You can be flexible in how you approach your food. You can really have freedom in how you live life without food, really maybe being a conditional part of your life, controlled part of your life, something that is assigned to morality, as I mentioned before, but maybe even feelings of disturbingness or worth. And I think what's really important is we start with food can be part of your life in so many different ways, and so many different foods can be part of your life. And that's really our non-diet approach to health and wellness and how that can be connected to eating disorder treatment. So Ellen Satter coined this term and concept and even treatment approach of normal eating. So here's a couple key terms of how to understand this concept here of normal eating, of really being able to go to the table hungry and eating until you're satisfied. Normal eating is also being able to choose the food you enjoy and eat it and truly get enough of it to satiate you and nourish your body. Being able to give some thought to food selection, while also not feeling like those thoughts are really taking you out of the way of your experience of enjoying food. Again, giving yourself permission to different ways of how you eat and how you eat with different emotions. And so really, in summary, normal eating is really that flexibility. It responds to how you're responding to the world around you, in terms of your schedule, your proximity to food, and also like your internal experiences, right? Like your own hunger, how you're feeling, right? If you're craving a certain food, right? And so we want eating to be normal, and this is one way of capturing what normal eating is.
Shiva, I'm just gonna jump in for a sec. Can you hear me okay, Shiva?
Yes.
Okay. I was looking at, I'm attached to the chat. I just keep reading all the questions because everybody has like good stuff to say. Jean says, what about the term healthy instead of normal? And I think my response to that is that we tend to, healthy versus unhealthy in the eating disorder world are not terms that we love, because people tend to term healthy and unhealthy foods. But I hear you on normal isn't necessarily, there could be different variations of normal, but I kind of wanted to throw out there that the normal eating versus healthy eating, diet culture has kind of turned healthy versus unhealthy into something that it shouldn't necessarily be, if that makes sense. So I just wanted to throw that out there.
Okay, so I think I know we have a little bit time left to consider, and we want to offer some more time for questions. But some questions to consider in terms of like, again, continuing this conversation, or kind of like reflecting to yourself in terms of you, your loved one, people around you, in terms of your relationships with food, emotions, and eating, and body image, right? So here are some on the screen. Can you eat when you're hungry and stop when you're satisfied? Do you make food choices just based on the foods you enjoy? Do you feel like your food selections include a variety of foods, right? These are some questions that maybe we think about, maybe we don't, but maybe if you feel like one or more of these questions is something that really gives you certain questions or an answer that gives you pause, maybe it would be helpful to have more conversations about what food looks like in your life. And whether that means just talking to others and having like a really supportive conversation, or getting more support with the resources out there, I think it's really important that we all, at certain points of our life, really explore relationships with food and eating. So that way we feel like they are part of our lives as opposed to taking up our lives. So being a safe place for yourself. I think part about approaching food and your relationships with food, or even eating disorder recovery, if that's part of your experience for you, is really starting with yourself, right? So being able to seek support, and seeking support from people who value who you are. Being wary of certain conversations. It's okay to have boundaries if it's about something that maybe is centered around food and exercise, and that's something that you're working with. Being really involved in things that are important to you, like activities that bring you joy. Taking note of what's going on for you, right? Like taking inventory of your emotions, right? Like what we talked about a little bit earlier, learning about your emotions a little bit more in depth by like kind of looking at them more, and your behaviors, right? What makes you feel good versus what makes you feel trapped or stuck. Increasing your awareness with your emotions. I already said that because I think it's so important. And reaching out for support, which I also said that because I think if all things lead to, I want to talk to someone more about this, reach out. then being a safe place for others. Hopefully some of this discussion, maybe sure, it left you with questions, but maybe I hope it brings like a little bit more place of connection and understanding to what others might be struggling with, even if you don't struggle with it yourself, right? So just be mindful of your own words and behaviors. Maybe it's important to take the focus off of size, food, and weight. Even if you're having your own internal dialogue, maybe just notice how you might or might not bring it into conversation. Avoid that negative self-talk and promote more positive self-talk, starting with yourself, and maybe that'll be a model for others. Really respect and embrace differences. Underlining that word respect, we want to offer that space for others. Maybe respecting ourselves can start with that, and then also being sure that others feel respected in spaces with each of us. Then a lot of these things, right? Really evaluate the messages, information out there that might really be woven into a lot of the pieces that we're mentioning about eating disorders, diet culture, and things that really promote this thin ideal and how to think about weight and body image, and really being critical about what does this information really speak to, and what does it mean to me and others around me. And I think that's how we can really, again, foster this space for us, ourselves, and then with others to continue to have these conversations with each other. So that's kind of all we have. Again, just really starting the conversation with you all, and a couple of things that we think are really important here at Renfrew, and really as eating disorder providers, these are conversations that we have all the time with each other, with patients, and I think it's so important to have these conversations with anyone, right, with supports, and to also know how to lead into more conversations with each other in a safe and supportive and listening ear manner. So I think we really thank you all for coming together today. I know I haven't taken a really close look at the chat, but I think offering some more time for some Q&A.
Yeah, thank you so much. I want to say this was great. And yeah, a lot of things in the chat. Casey, I also kind of went through and, and was glued there for a moment. Yeah, I mean, I'll kind of bring it to Casey. We still have quite a bit of time, like 15 minutes. We obviously don't have to use up that entire time, but yeah, Casey, do you want to start with anything that you thought was notable in the chat?
Yeah, somebody asked, excuse me, about BMI. And I just wanted to expand on that a little bit. At Renfrew, we don't use BMI. Because you're right, BMI was taking into consideration, so many years ago, white European males, and they went off of that. It's really not accurate for the, for the general population. What we look at Renfrew, we look at growth charts a lot. So we look at, if someone is riding the 70th percentile growing up, and then, at 17, they drop off. We're looking at the growth charts. We really take into consideration where what curve you're on, which would lead to where you should be, what a set point weight should be. I just hesitated and I was going to say healthy, and that is not the term I want to use. So what your set point should be. We use set point in terms of where your body wants to live. So, and that's what's difficult about dieting is that, when somebody loses a lot of weight and then gains it back and then loses it again, and, it's your body's confused, right? It's like, where am I supposed to be? So set point is kind of like where your body lives and where your body's happy. And we try to encourage patients to trust their bodies, that your body will figure out where it wants to be if you do the things that your body needs. So, eating 3 meals and snacks a day, eating a variety of foods, exercising, for what feels good, not to lose weight, those sorts of things. So a long answer to a question of BMI, we don't typically use it.
I'd like to jump in with some questions, because there were a ton of good questions in the chat, and there was a set of questions that were kind of focused on boundaries and like, how do I respond to people who are commenting on my weight? particularly like, unfortunately, people sort of think that it's okay to comment negatively on people's like bodies, even like to strangers. So like, do you have any ideas about how to, can you talk about, somebody sort of mentioned like responding to comments, people who don't want to, listen to people who are, talking about food or talking about dieting. Can you talk a little bit about that?
Yes. Huge question. I'm going to give a shorter version of an answer, but this is a huge conversation of topic in a lot of spaces that I've been a part of. So I think even in the more general sense, right? Someone might come in and be like, oh, hey, did you hear about this thing that's happening or this social media post? And what they're trying to search for is connection with you in a conversation, maybe just literally a conversation starter. But you yourself might be like, this is an immediate disconnection for me. It might also be not okay or harmful for me right now. And I think it's important to set that boundary and maybe naming, something like, hey, like, I think you're bringing this in, but I actually don't really feel like talking about this right now. And that's a great way of like, regardless of who that person might be, you might not delve into like, hey, I have an eating disorder, I'm really struggling, and that's why I can't talk about this. You might just mean, hey, like, I don't really find this to be a conversation I'm interested in right now. And I think that's like one way of naming what's going on in your experience. And of course, you can kind of take a step further with different people that you trust in your life. And then, right, like someone who might express like concern about weight, right, or want to comment about body image in a certain way about you, right? Maybe that person has certain beliefs and values that they're trying to communicate to you that's connected to weight, right? And for you, you might have had this, you don't need this person to enlighten you or point this out, right? And again, there's a whole range of how you could communicate that with them. But I think one part is like saying like, hey, I hear what you're saying, or I hear where you're trying to go. Maybe that's important to you, but that's not important to me right now. Or I don't really find this something that I'm connected to or wanting to talk about right now. And I think it can be really hard, right? Because saying a thing doesn't necessarily mean it ends the conversation. People are coming in with a lot of different feelings, but also I really think a lot of beliefs and values that they think are important to trying to communicate in conversation. Sometimes we have to a little bit hold our own of like, I hear you, but we might disagree here actually. So that's kind of, again, like a quick taste of what I think you can have in terms of communicating boundaries with others, but it's a whole other beast of a thing to approach for sure.
And I also think, leading by example as well, like Shiva said in one of the slides, you yourself not talking about people who have gained or lost or who look different, or just commenting on people's bodies, I think is obviously a great place to start too.
There were so many good questions. I don't even know where to start. One that I think is interesting that might apply to a larger group of folks. If you are noticing that you are creeping towards like you're increasing preoccupation, or you're sort of getting more towards that end of the spectrum, what do you recommend doing?
Yeah, I definitely think that starting with like maybe some initial person to kind of support you and talk to. So maybe that means talking to a therapist about it, whether that be your own therapist, even if you haven't arrived at that conversation on food and eating yet, bringing it in yourself, or maybe starting with a therapist for the first time, right? Doesn't mean you have to come to Renfrew for our full range of treatment that you heard about a little bit earlier, right? You might just need to like kind of figure out what's happening for me and kind of need another person to kind of support you in exploring that. So really just find like a provider that can support you in that conversation. And then what that really offers you is a person in your corner, right? So that provider can then connect you to more treatment if that becomes something that you need. I see something in the chat too about a dietitian. Absolutely. I hope your therapists are connecting you to dietitians and psychiatrists and other groups. You don't need to come to Renfrew for many hours a day to go to group therapy either. There's so many awesome spaces. Yes, like in terms of like community spaces, where you can kind of find support groups and really just foster what you need, and different conversations and different resources and providers looking out for you. And I think what it really offers, and that's why, like, you know, in Casey and I working together, it's really comprehensive treatment. It's looking into a lot of different things. So as long as you have a starting point, I definitely think like a lot of different specialized providers on your team can offer a lot of different perspectives to your individual needs that can help you get some support, get some initial people to talk to. And if you need more, they'll help guide you in that direction as well.
I think along similar lines, somebody asked, I have a family member who's dealing with anorexia, but is afraid to seek help. What do you recommend? And there was also a question which I think might fall under the same umbrella of how can we help kids and teenagers dealing with eating disorders?
I think, like we mentioned before, eating disorders are often only like part of the picture. So if anyone that you know is willing to start some therapy and have a space for themselves to talk to someone, I think that's a great starting point. I think we could all in some way in our life recognize, like, sometimes we can't acknowledge something or approach it, even if someone tells us, right? But if we're willing to approach some level of support, I think it's really awesome to start with therapy, even a psychiatry. And if you're willing to explore your relationship with food, a dietitian too. You don't need to have an eating disorder to work with a dietitian. There's a lot of people that, you know, seek that kind of support too. So I think, right, like if you're able to explore that curiosity with someone in your life or a teenager, I think that's an important place to start. Maybe what's really helpful is that relationship with a provider can help someone better understand what's going on for them and maybe better identify with having an eating disorder over time. But maybe that's what it takes too, time and get that support. But I think the first thing you can do is just show up for that person and offer them those spaces. I will say if you're, oh, sorry, Casey.
No, go ahead, Shiba.
I would say if you're super, super concerned and like things are like, there's a lot of red flags, you know, someone's really struggling, they're either not able to turn away from food, they're not showing up in their life at all, or, right, you're really concerned about their well-being and safety. Of course, you might want to act more immediately. And just because it's around food doesn't mean it's, you know, not super concerning, right? You can always take them to emergency service if you need to too. If you're really, really concerned about this person.
Yeah, I was just going to add, you know, modeling a positive relationship with food and exercise in your body for teens and adolescents is a great place to start too.
Yeah.
That was actually another question. Can you talk a little bit about what that looks like, modeling that kind of relationship?
Sure. I think it's always interesting to talk to people because I think that people think that they do have a really good relationship, and then they realize that they actually maybe say some things that aren't as positive as they should be. You know, so not commenting on, oh my gosh, this has so many calories. Oh, don't eat that. You can't have too many desserts. You know, the comments like that kind of seem like something maybe that was taught to, you know, that was said to you when you were growing up, or you still say, you know, those are comments that, you know, kids and teens can take with them. So, you know, kind of just normalizing, you know, maybe not making, you know, I don't make my daughter finish her plate. You know, I let her, you know, she eats when she's hungry. If she tells me she's done, and, you know, I appreciate that, and, you know, we're good, you know. So I think modeling, you know, eating 3 meals a day, eating snacks when you're hungry, stopping when you're full, not making comments, you know, about calories and carbs and fats, and, you know, if that's something that you need for a medical condition to monitor, then I think, you know, keep it to yourself. You know, I'm not saying that, you know, someone who's diabetic shouldn't be watching their carbs. That's not what I'm trying to say. But what I'm trying to say is, if you need to do that, you know, put it on your phone or put it in your diary or whatever you do with it, and maybe not make comments about it to your kids or to your significant other who need to have a normalized, eating pattern.
Yeah. Something I want to add too is like, right, like how we talk about food is, it's really hard to think about like totally switching gears and okay, how do I like totally only offer supportive spaces and supportive languaging? It's hard. And so when we also talk about modeling, like we have different influences in our lives that have brought us to how we approach food and eating, right? So I don't think any of this is meant to pathologize or be really critical of how we are, but right, maybe there's a certain degree of learning for all of us, regardless of what age we are, to like evaluate how we approach food and eating. And I think that's really important. It's like, right, at some point in our lives, I think we should like explore like, okay, what does this mean for me? How does food connect to my identity? How does it connect to how I feel about food when I eat it and how I feel about myself, just about myself? And I think there's a lot of different influences that get us to where we more immediately think and act around food. But I think at some point it's really important for us to reevaluate that part of our identity and relationships with food and eating in that way. So I think I want to like echo what Casey said. All those points of modeling are really important because they can start with us now. And definitely if you have families, right, like can start then, but also even for ourselves, right? It's important for us to kind of explore that relationship and explore where it came from and where we would like it to go.
Thank you so much. And I do want to just emphasize for folks that we are unfortunately not going to be able to get to all of the questions. So I'll just say that unfortunately that is definitely going to be the case. But I do want to ask if you can talk a little bit about what treatment might look like for somebody that is also struggling with substances like alcohol or marijuana or like any kind of substance use disorder. Yeah, can you talk a little bit about that? That's come up a couple of times.
Yeah.
Yeah, I was going to pass it to you actually.
Yeah, sure. So part of our treatment program, you meet with a therapist, a primary therapist, a psychiatric provider, so either a psychiatrist or a psych nurse practitioner, and then the dietitian. There's also, but primarily it is group therapy. So there's specialty tracks that we have, and we have one for substance use. So we have a substance use specialty track where they attend, the groups with that specific issue. But it can also be brought into your sessions with your primary therapist, brought into your sessions with your psychiatrist. For medication management, we could use medication for some of that, substance use concerns. And then we also kind of reflect back to the community and refer to, AA, NA, any other support groups that can help with that.
Yeah, and it's hard to like capture like how we like fully respond to working with eating disorders, other co-occurring concerns such as substance use. But I think it's really important to explore eating as well as substance use as like what do those serve as a function or dysfunction in your life, right? So what that looks like for each person, as well as what that looks for each person in their eating disorder recovery and their substance use recovery looks different. So I think it really is an important thing to look at. Maybe you need like some substance use specialized treatment in addition to eating disorder specialized treatment. What might be primary in case something is a more major concern at a certain time also kind of leads to what you might work on at different points and different providers that you definitely need on your team as well. And I know we're going to kind of wrap up the conversation, and I know we're not getting to all the questions, but I do want to offer in this space, this is really only a starting point in conversation and some information that we wanted to offer here. I hope it brings some curiosity and different connections to people in your life, but please also don't use it as a substitute for reaching out for more resources or more support. You're definitely deserving of a lot of support. I know we can only offer you so much support verbally in this space and answering questions. I see you all are supporting each other in the chat. Please also find your own individual resources for your family, so that you're not alone, and also that you don't only have to come to free spaces like this. There's a lot of different resources out there, and I hope you all can find ways to access it and have the right people in your corner.
Absolutely. And I think that that's a really great note to end on. I am sorry that we were not able to get to all of the questions. We are, as I said in the chat, going to be sharing additional resources in an email in the next few days to everybody who registered. So you can look for that. But thank you all so much for being here. Thank you to our interpreters. Thank you, of course, to Ruthie, to Sheba, to Casey for organizing this, working with me to set this up. Thank you to all of you for attending, both whether you're on Facebook or on Zoom. We appreciate your conversation, your questions, your comments, and your conversation. And we hope that you have just a really fantastic rest of your evening. Thank you.
Thank you so much.